Hello, and welcome to the COVID-19 Emergency Temporary Standard, EST, overview and training provided for Bay Aging supervisors and employees. In the face of the devastating impact of the COVID-19 pandemic, the Virginia Safety and Health Codes Board has adopted an emergency temporary standard to protect employees and employers from the spread of COVID-19. This is for the safety of all employees. As an employer in the state of Virginia, Bay Aging is required to comply to the emergency temporary standard, which is in effect immediately. The following slides will walk you through the 9 steps Bay Aging has taken to ensure compliance with this standard. It is important you watch the entire presentation so you understand how this standard applies to you. Step 1. It is the supervisor's responsibility to complete an assessment of their staff's workplace for hazards and job tasks that could potentially expose employees to COVID-19. Each supervisor should take the criteria listed here into consideration while determining risk level for each position. A hazard assessment worksheet has been provided to supervisors from the Human Resources Department to aid in this process. The worksheet requires each job task to be classified as lower risk, medium risk, high risk, or very high risk based on the probability of exposure to the virus while completing that job task. The sheet also requires engineering and administrative controls as well as personal protection equipment to be listed for each task. Once completed, the supervisor will review the assessment with their staff and post it in a common area for employees to easily access. Based on the assessment, each job will be classified on these risk levels. The majority of Bay Aging employees will fall into the lower risk or medium risk category. Please ask your supervisor which category you fall into. Step 2. Bay Aging has established a self-assessment illness attestation that all employees are required to sign. This attestation was printed and mailed to your home at the end of May, or provided during your onboarding if you have joined our team since then. In summary, it states that you will perform a self-assessment for signs and symptoms, including a temperature check, each day prior to reporting to work, and that you will not report to work if you have any of these signs or symptoms and will notify your supervisor immediately. If you have misplaced your copy, please request one from Human Resources. Step 3. Bay Aging has implemented flexible sick leave policies, telework, staggered shifts, and other administrative and work controls to reduce or eliminate contact with others within 6 feet. For employees who are not eligible for Bay Aging's paid sick leave, you may qualify for paid sick leave under the Families First Coronavirus Response Act if you have a qualifying circumstance. Please contact your supervisor immediately if you need time off related to COVID-19. Step 4. Bay Aging has established and implemented procedures that will prevent sick employees and other persons from infecting healthy employees. Employees are expected to practice social distancing of 6 feet or more, wear appropriate personal protection equipment such as masks, which are required in all offices, gloves, and/or face shields. They should regularly wash their hands or use hand sanitizer if a sink and soap is not available, as well as regularly sanitize touch surfaces such as pens, bathroom surfaces, kitchen surfaces, and other high traffic areas. Your supervisor will review a cleaning schedule for your building. As mentioned in Step 2, employees who report symptoms should not report to work. Employees who are suspected or confirmed to have the virus are prohibited from returning to work until they have been cleared through a symptom-based or test-based strategy. If you have questions or concerns, please consult a healthcare provider to ensure it is safe for you to return to work. Step 6. If you or another employee in your workspace becomes infected with the virus, all employees in that workspace must be immediately notified so they can take personal actions to protect their health and safety. This will be sent out via email, phone call, or any other appropriate means. Please note the infected employee's name will not be released to other staff. Step 7. The anti-discrimination provisions of the standard indicate that no employee shall be discharged or in any way discriminated against for the following 3 reasons. They are exercising their rights under the safety and health provisions of Standard 90, Title 40.1 of the Code of Virginia. They have voluntarily provided and wear their own protective equipment, such as masks, gloves, face shields, or other devices, as long as they do not create a great hazard to the employee or other employees. Raised reasonable concern about infection control related to the SARS-CoV-2 virus and COVID-19 disease to the employer, other employees, a government agency, or the public through any media outlet. Step 8. Since Bay Aging meets the prerequisites listed on your screen, an infectious disease preparedness and response plan is being developed and will be implemented within 60 days of the effective date. Step 9. Bay Aging is required to provide COVID-19 training to all medium, high, and very high-risk employees within 30 days of the effective date and to all new hires after that date. In addition to understanding the requirements of the standard we just reviewed, all employees must be aware of the characteristics and methods of the spread, as well as risk factors and awareness of transmission. Let's walk through a quick overview. Coronavirus is named for the crown-like spikes on its surface. It is a respiratory disease that is mainly spread by close contact from person to person by airborne respiratory droplets produced when an infected person coughs, sneezes, or talks. Symptoms of the virus affect each person differently, with symptoms ranging from mild to severe. Symptoms may appear 2 to 14 days after exposure to the virus and include chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. There are indications that some infected people may not exhibit signs or symptoms of the virus, and these individuals can unknowingly spread the virus to others. Because of this, it is imperative employees follow all health and safety precautions to prevent the spread. If you have any questions on these temporary standards or Bay Aging's compliance to the standards, please refer to the training materials provided, contact HR or your supervisor, or visit www.doli.virginia.gov.